Don't forget to like, comment, and subscribe for your regular dose of Asian health information.
A lot of patients ask me why I feel tired after I've had a huge meal. Now, to explain it in medical or scientific terms, this is largely because as food, the nutrients enter your bloodstream, it produces a large surge in insulin. The insulin then brings down the blood sugar and you have a sudden drop in the blood sugar level in your bloodstream. And then this is what makes you feel sleepy and tired. So what I advise my patients to do to avoid these large insulin fluctuations and large fluctuations in glucose in your bloodstream is to take smaller meals 5 times a day at regular intervals. So number one, because you keep those hunger pangs away, and number two, you can manage the amount of input that you take at each one meal. Yeah, so eating healthily, such as vegetables, fruits, nuts, at regular intervals throughout the day, rather than starving yourself, and I think makes you not only keep the weight away, but makes you a happier person. I mean, nobody wants to be hungry, right? Yogurt is a very interesting dietary food that a lot of patients have some misconceptions about. Number one, the most important thing to understand about yogurt is that it is a dairy product. Now, 70% of Asians are lactose intolerant. There was a very interesting documentary that was aired in National Geographic recently, actually, about how the lactase gene was brought across from the nomads from Central Asia across to Europe, and that's why a lot of Europeans and Caucasians in general are able to digest lactose, whereas a large percentage of Asians can't. So if you are lactose intolerant and you are persistently taking yogurt because you think that it's good, and you are developing symptoms because of that yogurt, such as bloating, diarrhea, nausea, please stop. It's not good for you because you can't digest it. Now, a lot of people eat yogurt because they think that it has probiotics or good bacteria in it that are helpful. There are lots of alternatives that are non-dairy. Okay. Now, there are some yogurts that have a lower percentage of lactose in it. So you can read that on the labels, and that may be helpful if you are lactose intolerant. There are also lactase replacement capsules or dietary supplements that you can take if you do really want to eat yogurt. You can approach your doctors to see, learn more about that. A lot of patients like to Google about their symptoms, and they ask me whether it's alright for them to Google about their symptoms. Now, the thing about Google is that yes, it will present to you every search that it has found in the last 20 years. Now, the most important thing about seeing a personalized physician or a doctor is that they have the experience and the sixth sense to discern those subtle nuances in the symptoms that you are telling us about. So I am most happy then to refer to Google with my patients in front of them and tell them about what might be suitable or applicable to the symptoms that they're having, and then explain to them why maybe the symptoms that they're telling me about do not apply to this other disease or disorder that Google has brought up. Now, dysphagia is the symptom of food getting stuck within your swallowing tube. Now, there's several things that essentially come to mind when we discuss dysphagia. Most importantly, obviously, is cancer. Now, esophageal cancer is pretty rare in Singapore. There are two types of esophageal cancer. One that arises from the inherent lining of the esophagus, and one that arises from the cells that arise from the stomach, or the first part of the stomach. Now, if you look at the statistics of esophageal cancer in Singapore, you'll see that there's a decrease in the incidence of esophageal cancer that arises from the lining of the esophagus per se, called squamous epithelium. And this is because we've seen a decrease in the habits that were risk factors for esophageal cancer maybe 50 years ago. There's a decrease in the incidence of smoking, taking very hot liquids, habits that were associated with migrant workers that came to Singapore at the turn of the 1900s. There's an increasing trend of what we call esophageal adenocarcinoma, which we think is due to the risk factor of acid reflux. It's one of the fastest rising cancers actually in the Western world, but at the moment in Singapore, the incidence of these cancers is still pretty low.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.